It's Professor Michael GATZOULIS. I'm a cardiologist from the Royal Brompton Hospital, attending the Right Heart Summit in Padua in early March. This is one of the best meetings that I have attended. It is very timely that the right heart is addressed in this wonderful forum. My subject and the talk that I gave at this meeting yesterday at the beginning of it at the Palazzo di Bo was the systemic right ventricle in congenital heart disease. Congenital heart disease and pulmonary arterial hypertension is what I do. The systemic right ventricle, that is the right ventricle supporting the systemic circulation, has additional layers of complexity to the normal right ventricle. It is seen in a number of conditions in congenital heart disease, mainly in the setting of transposition of great arteries, but also in the setting of very complex congenital heart disease with a so-called single ventricle physiology. Its overall prognosis is somewhat guarded, and perhaps not surprisingly, the systemic right ventricle does not do as well as the systemic left ventricle in any of these conditions. It is crucial in the setting of the systemic right ventricle of the properties of the tricuspid valve. In a subset of patients with congenital corrective transposition, there are intrinsic abnormalities of the tricuspid valve affecting right ventricular function longer term. Stop. This needs to be addressed, usually with early surgery. There are other things that we can do to preserve right ventricular function in this setting. Stop. Addressing additional hemodynamic problems or optimizing hemodynamics is very important. It is also the case that patients with a systemic right ventricle often have intrinsic abnormalities of their conduction system that presents challenges but also opportunities. Last but not least, and I try to emphasize this in my talk, there are a lot of peripheral to central interactions that may have a positive impact on systemic right ventricular function, including exercise and exercise training that merit attention. So I repeat myself here, this has been one of the best meetings that I have attended, and I've learned a lot. And not to mention Padua itself, the venues, this wonderful weather, we are very lucky for it. Thank you.